Good day, I am Rivera from BSN1B. So today, I am going to assess the neck of a patient. So first, what we are going to do is we are going to assess the client's history of neck. So I'm going to ask the patient first for the history of her neck. So, ma'am, do you feel any pain in your neck po? None po. History of neck pain po? Wala din. May stiffness po sa neck. So, none po. So our patient responds none, so it's a normal finding for our patient. So next we are going to do is we are going to inspect the range of motion of the patient, the symmetry and the skin condition of the patient. So first that we are going to inspect is the range of motion, which is I am going to ask the patient to move her neck. So ma'am, i-check lang po natin yung range of motion niyo po. So tingin po kayo sa baba po, ma'am. Tingin po sa taas. Tingin po kayo sa left side po. Left side. Right side po. Tingin po sa akin straight po. And skin position. So as I inspect the patient's neck, range of motion, it is in the range of motion of the patient is in a normal finding, and also the symmetry of the patient is symmetrical, and the skin condition of our patient is the neck of the patient doesn't have lesions or any rashes, redness, or any discoloration also. So next we're going to do is we're going to palpate the lymph nodes, the trachea, and the thyroid gland of the patient. So I'm going to palpate now the lymph node, the trachea, and thyroid. So ma'am, palpate po ako sa ano niyo po. Sabi po kayo kung may pain kayo maramdaman po. Wala po, ma'am. Wala din po. Ito po, ma'am. So, as we palpate the cervical lymph nodes of our patient, there is no tenderness as she responds, and also the lymph nodes of our patient is also elastic. And for the trachea and the thyroid gland, there is no edema and also no tenderness. So, next thing we are going to do is we are going to assess the carotid artery and the jugular veins of our patient. So first, we are going to assess the carotid artery, which is we are going to palpate the both sides of the carotid artery of the patient. So, ma'am, palpate po ako ulit sa carotid po. Next is, for the jugular veins, we are going to inspect the jugular veins of the patient. Inspect po ako the jugular veins. So, for the assessment of the carotid artery, the carotid artery is palpable, and for the jugular vein, as we inspect, there is no jugular distension present in the jugular veins of our patient. So, lastly that we are going to assess is we are going to assess the muscular strength of our patient. So, ma'am, assess po ako sa muscular strength po ninyo. So, follow niyo lang po ako. Tingin po kayo sa right side niyo po. Then, sa taas po. Okay. Kabila naman po, ma'am. Left po, then, ito sa up. So, for the assessment findings of the muscular strength of our patient, the muscular strength of our patient is there is no difficulty of the movement for the neck of the patient, and also no weakness of the muscles of the neck. So now we are going to assess, or we are going to start to assess the thorax. So first, we are going to assess the respiratory of the patient. So for the respiratory, we are going to assess the client's history. So I'm going to ask a further questions to our client. So, ma'am, meron po kayong respiratory problems po?
Wala po.
May respiratory disease po?
Wala.
Allergies po, mga allergies, disease?
Wala.
Pain. May pain po kayo sa respiratory niyo po?
Wala.
Difficulty in breathing?
Wala.
So, next is we are going to position and break the client appropriately. So, we are going to position the client in a proper sitting position, and we are doing this because we need, it is better to assess the respiratory of our patient in a sitting position. So, I'm going to position the patient also. Ma'am, sit ka po tayo paparito. Next, we are going to do is we are going to inspect the anterior, both lateral and the posterior of our patient for the respiratory rate, the rhythm, the depth, and also the symmetry of the thoracic movements as the patient during the respiration. So, inspect ko lang po, ma'am, breathe po tayo po. So, as I inspect the patient, the assessment finding that I have here is the respiratory rate of our patient is irregular, and also the rhythm is inconstant, and constant regular with a depth of normal, and also the respiratory is symmetrically. So, next is we're going to inspect the anterior chest for the condition of the skin of the patient, and also for the intercostal retraction or with bulging, and the symmetry of the clavicle of our patient. So, I'm going to inspect po, ulit po, so po sa chest nito. So, after inspecting the anterior chest of our patient, we have an assessment of the patient doesn't have any lesions, scars, or wounds, and also the clavicle of our patient is also symmetrically, and I didn't find any, or there is no presence of a intercostal retraction and a bulging. So, next is we're going to assess the anterior and posterior diameter and the thoracic curve, noting the respiratory excursion. So, ma'am, mag-assess po ako sa respiration po. Sit po tayo pa dito. Hinga po tayo. Sa likod po. Hinga po tayo. So, after assessing the anterior and posterior of the patient, we have an assessment finding that it does rotate away from the midline equally. So next is we're going to inspect the posterior chest for the spinal deformities of the scapulae. So, I'm going to inspect the posterior of the client. So, ma'am, check ko lang po likod po sa So as I inspect the posterior chest of our patient in the scapulae, there are no deformities found in the posterior of the patient. So next is we're going to palpate the anterior, the lateral, the posterior chest for the masses and tenderness or for the crepitus of the patient. So, ma'am, palpate po ako sa chest po, ha, sabi ko may pain, ay nagdagas. Good po, ma'am. Pain po, wala po, ma'am. So, after palpating the anterior and the lateral and the posterior of the patient, we do not have found any presence of the tenderness and masses and of crepitus in the patient. So, next is we're going to palpate the sternal notch for the tracheal position. So, palpate po ako ulit, ma'am, sa So, after palpating the sternal notch for the tracheal is, we have an assessment that the central placement is in the midline of the neck. The next thing we are going to do is we are going to palpate the anterior and posterior for chest for the exertion, vocal, and tactile for formities of the patient. So, palpate po ako na. So, after we are done with the palpation, we have an assessment finding which is the chest is symmetric or symmetrically, and the anterior and posterior is transverse diameter in a ratio of 1 to 2. So, the next thing we are going to palpate again, but to the spine of the patient for the bony deformities. So, palpate po ulit ako sa likod po, ma'am, ha, para check yung spine ko. Kasi space na po tayo. So, after the palpation again is, we have an assessment finding that the spinal cord of our patient is in a straight, and also the left and the right shoulders of our patient is, and also the hips are in the same height, and there are no findings of a bony deformity. So, the next is we're going to percuss the anterior, the lateral, and the posterior intercostal spaces, and noting for the sound. So, percuss po ako, ma'am, ha. we are done with the percussing for the anterior, the lateral, the posterior of the patient, and we have a assessment finding that the sound is in a normal bowel sound for the as we percuss it. So, okay. Next is we're going to auscultate over the auscultatory sides of the patient in the anterior, the posterior, and also the lateral of the patient. Auscultate po ako, ma'am. Posterior po muna tayo. So, after we are auscultating the patient respiratory is, we have an assessment finding that there is no any abnormal sounds that we have heard or like a wheezing sound or a crackle sounds in the as we auscultate the patient. So, lastly is we are going to note the normal and abnormal breath sounds of the patient. So, for these findings, as I note, the breathing of the patient is, the breathing is normal, and there is no signs of abnormality sounds as I assessed earlier to the patient and as I do the interventions in the respiratory patient. So that will go for the respiratory. So now we are going to assess for the heart. So first, we are going to assess for the client's history of the chest pain or palpitation and fatigue. So I'm going to ask the patient further questions. So, ma'am, meron po kayong chest pains po, ma'am? Wala. History of palpitation po. History of fatigue po, ma'am. So we are going to position and drape the client appropriately. So it is to assess the patient's heart better. So ma'am, position po kita ng proper lang po. Para ma-assess po yung heart po better. So next, we are going to expect the pulsations in precardium and particularly in the apex area of the patient. So assume that we drape the patient's shirt, so I'm going to inspect the precardium of the patient and so as we inspect the precardium of the patient, so there is no pulsations that found. So next is we're going to identify and palpate the cardiac sites for pulsations, thrust and chills and hips for the patient. So palpate po ako sa cardiac sites po ma'am ha. So as we identify and palpate the cardiac sites of a patient, there are no murmurs, and for the assessment find there are no murmurs, no abnormalities in the beating, and also for the vibrations of the patient. So next is we're going to auscultate the cardiac site of the patient. Auscultate po ako ma'am ha. Warm ko lang po yung diaphragm. So as we auscultate the cardiac sites of the patient, the assessment finding for the patient's cardiac site is there are no abnormalities in the cardiac site of the patient, and also the S1 is louder than the S2. So lastly, that we are going to do for the assessment with the heart is we are going to auscultate the heart sound, noting area and the rhythm and extra sounds or the murmurs of the heart. So I'm going to auscultate again the patient. So auscultate po ako ulit ma'am ha sa heart ko po. So we are done for the auscultation of the heart. So as I take note for the assessment finding, the assessment finding for the patient's heart, as we auscultate, is there are no abnormal rhythm in the heart, and also the heart is in a good condition. So that's all for the heart. As for the assessment for the heart, now we are going to assess the breath of the patient. So first, we are going to assess the client's history. So we are going to ask a further questions again. So, ma'am, meron po kayong history sa breast lump po? Ano po, sa masses of the breast po, ma'am, may pain po ba? Or ano po? Wala rin po. Okay, sa tenderness sa breast po, ma'am, kung i-touch po yung breast nyo, may masakit po sa breast na nipple discharge po, ma'am. History po, wala. So, next, we are going to position and drape the client appropriately. Since we are not allowed to expose the breast of the patient, so assume that this is the patient of the breast, which is presented already here. So we are just going to assess the breast later on. So next is we are going to inspect the breast in a various position for the size, the shape, the symmetry of the breast, or there are any lesions or uh, if there are any retractions in the breast. So assume that this is the breast of the patient. So I'm going to inspect the breast of the patient. So as I inspect the patient's breast, we have an assessment finding that the breast of the patient is anatomical and equal in size, and also it also in a symmetrically, and also there are no lesions found or any retractions in the breast of the patient. So next is we are going to inspect for the nipples of the patient for the position, the direction, the discharge, or if there are lesions, the hair, and the presence of Montgomery tubercles. So I'm going to inspect again the breast of the patient. So after inspecting the breast of the patient, I have an assessment finding that the patient's breast is in a light brown color, and also the nipples is positioned at the center of the areolae, and also there are no lesions found in the breast of the patient, and also there is no swelling or any problem or discharge in the patient's breast, and also lastly, the Montgomery tuberculosis also is present in the breast of the patient. So second is we palpate the axillary lymph nodes of the patient's breast, and thoroughly noting the masses for the tenderness or also the texture of the breast of the patient. So assume that I'm going to palpate the axillary lymph nodes of the patient and also the breast of the patient. So I'm just going to assume that palpating here. So after palpating lightly or assuming we palpate the breast of the patient, we have an assessment finding of that the skin, or there are no signs of masses in the patient's breast, and also there are no tenderness in the patient's breast, and also the texture is smooth, the color is consistent also with the general appearance in the breast. So, lastly is we are going to note the nipple discharge for the color, consistency, and amount, and the odor of the breast. So we're just going to note for and also assuming that I note the odor of the patient's breast, since we don't have any physical breast that we are presenting now. So after we are done with noting the patient's breast, is we have an assessment finding that there is no any discharge and there are no presence of odor in the patient's breast. So That will be all for the breast. So now we are going to assess for the patient's abdomen. So first, we are going to assess the client's history. So we are going to ask again for your questions for the client. So, ma'am, do you experience abdominal pain?
Wala po.
Loss of appetite po?
Wala rin po.
Current medication taken?
Wala po.
Or any illness po, may ulcer po?
Wala din.
Now, after we assess the patient's history is we are going to position and drape the client appropriately. So, ma'am, higa lang po tayo po, ma'am, ha? So, we position the client in a supine position already. So, we position this because we need to assess the client appropriately. So, next is we're going to inspect for the general contour of the abdomen, note of the noting scars or any rashes, masses, and the shape and symmetry of the patient. So, I'm going to inspect the patient's abdomen. And also, assume that I already draped the client's shirt since it is not allowed to expose the abdomen of the patient. So, inspect po ako, ma'am, ha? So as we inspect the patient's abdomen general contour, for the assessment finding, there are no any scars or striae or rashes, masses, and also the shape of the abdomen is round and symmetrically and also in a flat shape. So next is we are going to auscultate the abdomen methodically, which is we are going to use a pattern and for the bowel sound and the vascular sound in the frictional application. So, ma'am, auscultate po ako sa abdomen niyo po. Warm lang po natin. Left. Auscultate po ako. So we are done with the auscultating the abdomen of the patient. So as I take note for the auscultation we come up with an assessment of there is no presence of any bruise or a venous humps in the patient. So next we are going to percuss in a methodically again to quadrant of the abdomen of the patient. So ma'am, magsabi po kayo sa akin if may pain kayo maramdaman ko, ma'am, percuss po ako sa abdomen po. So as we percuss the patient's abdomen, we have an assessment of there are no tenderness as the patient responds, none as we percuss your abdomen, and also no abnormal sound in the patient's abdomen. So next is, and also lastly, we are going to palpate lightly to the abdominal tenderness or the surface characteristics and the lymph nodes of the patient. So ma'am, palpate po ako, tapos sabi po kayo sa akin kung may pain po ulit ma'am ha. Wait lang po ako. So, as we palpate also the abdomen of the patient, we have an assessment finding that the lymph nodes are non-palpable, and also the patient doesn't complain as we palpate the abdomen, and also lastly there are no tenderness as the patients respond. So that's for the abdomen. So next we are going to assess the genitourinary of the patient. So I am just going to recite for the genitourinary of the patient, since it is not allowed to assess or inspect the private part of the patient. So we are going to start with the assessment for assess the client history of the patient, which is we going to ask the patient's history of when was her last period, if she is a female, and also if there are any disease that she experienced in the genitourinary, either it is a male or a female, and also if the family of the patient have a problem in the genitourinary that could pass to each and everyone of the family, and last is if she or he experienced an genitourinary surgery. So next, for the assessing the client's history, is we are going to position and drape the client appropriately to assess the genitourinary better. So after positioning the patient, is we are going to inspect for the external genitalia of the patient. It is either a female genitalia or a male genitalia. So we are going to inspect the hair distribution, the skin, the clitoris, the urethral meatus or the vaginal intotus or the penis for the male, the scrotum, and the perineum of the patient, or noting the lesions of the genitourinary. So after we inspect the external genitalia, we are going to inspect now the internal genitalia. For women, we are going to inspect for the cervix or the vaginal wall of the women. So next, that after we are done with the inspecting, we are going to palpate the external and noting for the pain, if the patient does have complaint for a pain, if there is in the masses also, if there are any lesions, and also rashes in the genitourinary of the patient. And also for the male, same thing goes for the male. And after palpating the external, next is we're going to palpate the internal genitalia of the patient, which is we are going to palpate the anal part, the anal sphincter, and noting the rectal wall, if it's the consistency of the anal. And after we palpate the external and internal, we are going to auscultate for the scrotum for the male, and if hernia is in present. So last, for the genitourinary, is we are going to obtain the specimens for the diagnosis test. So that's all for the genitourinary. Now, I am going to assess the musculoskeletal of the patient. So first is we are going to assess the client's history. So I'm going to ask again for this further questions to the patient. So ma'am, may joint disease po or arthritis po? Problem sa muscles po or sa bones mo po?
Yan.
And next is we are going to position the client, and drape the client appropriately. So, ma'am, sit po tayo properly. Legs po natin. Para relax naman po. So, after position the client is we are going to inspect the upper and the lower extremities of the client for the size, symmetry, deformities, or the length in the muscles of the patient. So, I'm going to inspect the patient. Check lang po ako lang. Ano na pa? So, as I inspect the upper and lower extremities of the patient, it doesn't have any deformities, and also the size and is in equal size, and also it is symmetric, and also it does the upper and lower extremities of the patient doesn't have any lesions that haven't found. So, next is we are going to assess the gait through the cerebral function of for the balance, coordination, and the accuracy of movement of the patient. So, allow me to adjust my camera po muna and pause po. Okay. So ma'am, kaya niyo ba i-perform na gamit po yung heels niyo po, ma'am? Okay po, perform niyo po, ma'am. Okay po, sir. Next po is perform po niyo na gamit lang po yung toes niyo po. Mag-walk po kayo. So next po, ma'am, is kaya niyo po ba i-perform na first is yung heel po ninyo, then next is yung toe po, tapos i-walk niyo po both. Right po. Slowly po, ma'am. So, we are done assessing the patient cerebral function. So, as I observe and also for the assessment finding, the patient performed the heel toe without any difficulties, and also she can balance and coordinate things. So, next is we're going to assess the muscle tone, the strength, and also the tenderness of the patient. So, I'm going to assess the patient. Ma'am, ano lang po? Assess it lang. Wala ko yung na-feel po na so, as I assess also the muscle tone and the strength of the patient, and also she responds to me as I ask if there are tenderness, I didn't find any tenderness for the assessment finding of the patient. So, now we are going to assess the joints of the patient for assessing the range of motion, and also if there are edema, tenderness, and also redness, if the crepitus is present, also if the patient is also in a stable state, and also if we find if there are any deformities in the patient. So, I'm going to assess the patient. So, ma'am, perform niyo po yung tingin po kayo sa Right side po. Right side. Sa left side po. Left side. Up po. Up. Bow po. Tapos next po is gawin yung pigment. Kabilang side. And then, so balikat mo po yung shoulders doon. So, isa lang po. Then, balik po. Kamay niyo po yun po. And then, hips niyo po para waist lang. Now po, ma'am, pwede po kayo mag-stand sa bed po tayo po. Para access ko lang yung foot po ninyo. So, sa foot po is, yung po dito. Then, kabila po. Tapos, yung ganito po. And, sa kabila po. Okay, po tayo. So, we are done assessing the patient. So, for the assessment finding of the patient is, I didn't find any difficulty of her movements, and also there are no tenderness or there are no complaints as she performed the activities that I instruct her, and also there are no deformities as I also inspect the patient, and also I didn't find any redness or the presence of crepitus is also none, and the patient is also in a stable condition. And lastly, we're going to palpate the lymph nodes and the pulses of the patient. So, I'm going to palpate now the patient. Ma'am, palpate po ako. Sabi ko may tenderness po naman. Bilok mo. Lymph nodes na po muna. Tapos, sa paa po niya. Sige po ma'am. Yan ko lang po sa paa niya. Kabila po. Sa pulse niyo po ma'am. Wala po din yung pain ma'am. So, we are done palpating the patient. So, for the assessment finding, I didn't find any swelling to the lymph nodes of the patient, and also as I palpate, she doesn't complain for any pain, so there are no tenderness in the patient, and also as I check the pulse in the radial and the brachial pulse also, the pulse of the patient is in a normal rhythm. So that's all for the musculoskeletal. So now we are going to assess for the sensory neurologic of the patient. So I'm going to assess the client's history first. So I'm going to ask further questions for the patient. So, ma'am, do you have a head trauma, history of head trauma po? Head trauma or loss of consciousness po? Nahihilo po ba kayo? Headaches po? May headaches po ba kayo? Or
Wala po.
psychiatric problems po? Or,
Wala po.
using drugs po? So we are done for the sensory neurological patient. So the patient responds to my question. So next is we are going to assess the cerebral function of the patient. So we are going to assess the client's behavior and also the appearance of level of consciousness and the orientation of the time and place and the person. So we are done with the asking earlier. So I'm going to just to continue the assessment findings in the patient, which is the patient's consciousness is in a good state because she was able to answer my questions earlier, and also next is we are going to assess the client's mental status and also for the cognitive function of the patient. So also for the assessment finding of this is she was in a good mental health status because she was aware of what I'm asking. Also her cognitive function is also in a good state. So that's all for the sensory neurologic and the cerebral function of the patient. Now we are going to assess the cranial nerves of the patient. So first is we're going to assess the client's sensory as superficial sensory, the sensory function. Ding! Next. Next is okay. And now we are going to assess the cranial nerves of the patient. So first is we are going to assess the sensory functions such as the superficial, the sensation, the deep sensation, and also the discriminatory sensation of the patient. So I'm going to give the things to the patient. So ma'am, close po natin yung eyes po ma'am ha. And then, describe niyo po yung things na ibigay ko po sa inyo.
Soft. Hard.
Next po, ma'am, mag-draw po ako ng letters pa.
Letter G.
Open the eyes. So, as I gave the things and also wrote a letter to the patient, an assessment finding for the patient is she describes the items and also the letter that I let her describe very well. So, the sensory function of the patient is also in a better state. So next is we are going to assess the client's reflexes in the deep tendon reflex, superficial reflex, and the primitive reflex of the patient. So here I have a improvised, sorry for this, an improvised reflex hammer. So, ma'am, I'm going to reflex your tendons po ma'am, and then adjust ko po muna siguro. Let me adjust the camera. So we adjust the camera, so I'm going now to reflex the tendons of the patient. So, ito ma'am. Then, move mo po. Okay. Wala namin po. Sige po, move mo po. Okay. Next po is superficial. Sige po, 8. Ano yan po sa akin? So, superficial. Bilok mo lang. Sa, ano lang, primitive reflex po. Sa biceps po. For the assessment finding, as I am done doing the reflex the tendons, the superficial and also the primitive of the patient, for the assessment finding is that the patient is in a responsive as I reflex also the parts of tendons, superficial and primitive. So that will be all for the